social distancing,
行动管制令
Pematuhan penjarakan sosial.
We want to break the chain of infection.
One of the best things that could happen right now is social distancing. We really have to think about it for the greater good. And people should start thinking collectively, not as an individual anymore, because it's no more about the person, it's about everyone. What we are trying to do is break the chain of transmission. And the modus operandi that seems to work is identify the cases early. We need to isolate them, carry out all the extensive tests that we are doing, and social distancing. So social distancing is to stop all these people from coming in contact with each other. So there are so many opportunities for infection. With social distancing, we plan to cut it all up so that the chances of spread is limited. But just imagine if all this is not done and people are just walking freely. I'm coughing on the cart, I'm coughing onto some vegetables, I'm not covering my mouth. These are all the ways that the virus is spreading. So social distancing helps to cut this chain of transmission. So when you see cases going up, we are very worried that if we stop too soon, we will create another wave. So we need to watch after 2 weeks, which is very good now, it's extended for 1 month. We can more or less judge after 2 weeks. Flattening the curve is just to reduce the number of cases and let it stretch over a longer period of time so that our hospitals can cope with that amount of patients. And also we buy time. So instead of the curve going right up, it flattens out. We may get the same amount of cases, but it's over a period of time. So at least over this period of time, we can find a proper cure, maybe a vaccine, and all this will hopefully stop the chain of transmission. Cases are rising, and we can imagine two scenarios. One is it is rising because the authorities are carrying out testing and they're testing and they're testing. They're going to all the contacts and they're testing them. So when you test, you find cases and it's rising. Another way it could be rising is people are just falling sick and they're coming to the hospital, which won't be a very good scenario. I think in Malaysia, they are testing all the contact tracing, all the high-risk people, all the people who have been exposed, and this is a very good thing because we know that all those with symptoms or those who have COVID out there are being detected. So we are going to assume that most of the cases here are being tracing or that we have detected are under contact tracing. So that's good, and it will go up. Until all of them who are infected are found, you're going to find the cases rising. So again, I will say wait until the end of the month to see how the graph is going, whether all our activities are doing is effective or not. Every country will rise. Unless you have caught it even before there were cases within the country, maybe that would have bought you enough time to detect the cases. If anyone has got symptoms, if you're sick, please get medical help and be very, very honest about where you've been. If you have broken this social distancing order, you have to tell the authorities. They need to know so that they can do contact tracing. So the only thing Malaysians have to do, no matter how hard it is to stay at home. So I can only say, stay at home as much as you can. And it's hard. No one has said it's easy, but we have to go through it.
Tinggal di rumah. Stay home, stay safe.
We are all in it together. We have to cooperate. Right now we are one. We are truly one, irrespective of race, religion, creed, rich or poor, no matter, we are all one. That's all I have to say.